President Biden is scheduled to give a major speech Thursday detailing his administration's latest efforts to combat the growing COVID crisis. The surge in coronavirus cases are pushing hospitals in some states to crisis levels and creating alarm for so many parents as pediatric infections soar. Kaylee Hartung has more.
Tonight, the country heading into the fall with 4 times more patients fighting COVID in hospitals than a year ago, over 100,000. In Idaho, one of the least vaccinated states, some hospitals now rationing care as a last resort, running out of critical equipment, space, and staff, forced to make tough decisions on who gets treated first.
We don't have enough staff. Nurses are leaving because they're burned out, and we simply don't have enough people. We don't have the manpower to take care of these patients.
Paramedics in Boise telling us nearly every patient with COVID symptoms they're taking to the hospital is unvaccinated.
This is the busiest EMS station in the state of Idaho, and there they go, out on another call.
This COVID virus has been kind of like a really long mass casualty incident that just goes on and on and on. And so it's been definitely tough on my people.
And with each day, mounting concern for the millions of children back in the classroom.
If they can't be vaccinated, you can help by getting yourself vaccinated to protect that child who can't be vaccinated.
1 in 4 new COVID cases are now in children. 2,200 kids are fighting the virus in hospitals. In Georgia, 4-year-old Addison Wisher dying from COVID a day after she was diagnosed while she was recovering from surgery. Ushri Bhattacharya and her husband teach at the University of Georgia. They worry about bringing the virus home to their 5-year-old daughter who has a rare medical condition. The associate professor pleading with the Board of Regents for mandatory masks on campus. This weekend's football game could draw 92,000 fans to the Bulldogs Stadium.
What will I do if something happens to her? Will the board be giving me an answer then? I'm begging them to do the right thing. Enough of politics, enough ideology. Let's make good scientific decisions.
In Pleasant Hill, Missouri, deputies breaking up a dispute over masks when a school board passed a new mask mandate.
We need to go back to a mask mandate with the way that the virus is spreading and how it's affecting children now.
In Miami-Dade County, Florida, the teachers union reporting 13 school district staffers have died of COVID in the last 3 weeks. Officials say none of them were vaccinated. Tomorrow, President Biden is expected to lay out a 6-step strategy to boost vaccinations and stop the spread of the Delta variant, just as experts are closely tracking a new rare variant called Mu, now confirmed in 28 states. Early evidence suggests it might be more resistant to vaccines. But today, Dr. Fauci making it clear Delta is still by far the most troublesome variant in the U.S.
We have Mu here, and it's getting suppressed by Delta. Delta's 99+% in the United States.
Our thanks to Kaylee for that. And joining us now is ABC News medical contributor Dr. Darian Sutton. Doctor, thank you so much for joining us. You're an ER physician. As summer turns into fall, how concerned are you about this ongoing surge in COVID cases as well as hospitalizations despite the widespread availability of vaccines?
I'm very concerned, Lindsay. As we're seeing now, the rates of vaccination are slowly decreasing, and we're seeing an increase in these cases. And although in the history of COVID-19, it seems to peak around the 6 to 8 week mark, we're coinciding that with the start of the school year as we have tons of children who are unvaccinated about to commence with their education and join in together in classrooms without vaccines, obviously. And so that increases the risk of further transmission and infection. So I'm just very concerned, and I'm trying to keep a close eye on these numbers so that I can pay attention to what's going on in my community.
And we're also, of course, seeing this rise in cases and hospitalizations when it comes to children, many who are too young to get the vaccine. Besides mask wearing, is there anything else that parents need to consider doing differently to help try to keep their kids safe as so many are returning to the classroom?
Great question. The main thing that we can do to protect children and the unvaccinated is to vaccinate everyone eligible around them. Children are more often than not going to get the infection from their peers, from teenagers and adults rather than their peers. And we also know that we can do mitigation efforts inside of the school to decrease the risk of transmission. And that includes masking children, distancing when possible, surveillance testing, and then again, vaccinating all of those who are eligible around them.
The FDA will soon consider whether to approve a 3rd booster shot for the Pfizer vaccine. How important is that in keeping this pandemic under control here in the U.S.?
I think it's important to acknowledge the value of boosters, especially when we're talking about our vulnerable populations. And by that, I'm referencing our patients who are immune suppressed and those who are elderly. But we cannot distract from the main problem, which is those who are unvaccinated are the main source of transmission, as well as hospitalizations and deaths. So we need to continue to focus on those who have not received a shot at all and making sure that they get vaccinated.
And what about the trade-off of vaccinating more Americans with a third shot while so much of the world goes unvaccinated? Could that possibly lead to more variants, including the threat of one that could become vaccine resistant?
You bring up two great points. The first is vaccine equity. We have to remember that this is a global pandemic, and President Biden and the administration has made efforts to giving out this vaccine to low-income countries. Just an important number to understand. In high-income countries, more than 50% have received at least one shot, and that number is monumental compared to low-income countries, where approximately 2% or less have received at least one shot. And we have to remember that this is a global pandemic, and although we want to make sure that we take care of the people within the United States, if we don't pay attention to what's going on around other countries in the world, it's going to soon become our issue as well, as we have seen in India when we had the surge and the association of the Delta variant, and now we're seeing in Colombia with the development of the Mu variant. Vaccines do not create resistant viruses, transmission does. So our goal is always to decrease transmission as much as possible.
And lastly, Doctor, you just mentioned the Mu variant. How concerned are you about that?
I'm paying attention to it, but I'm not very concerned right now. As Dr. Fauci had stated, the current dominant strain is Delta variant. What would trigger my concern is if the Mu variant surpasses the Delta variant, which luckily we have not seen yet.
Dr. Darian Sutton, we thank you so much for your time and insight.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.